If you have a patient who has had a fall, physical exam for a patient with falls, what are the things you want to know? We said that orthostatic hypotension was one of the serious risk factors. So orthostatic blood pressure will be one of the things you want to know. Then number 2 will be cardiac exam, because we said that if the patient has fall with loss of consciousness, which areas are we looking at? Which systems are we looking at? Can somebody remind me? If you have a patient who has a history of fall and the patient lost consciousness before the fall, what are the areas you want to assess?
Cardiac.
What?
Cardiac.
Cardiac.
Cardio.
What else?
Right. Neurological.
Neurological, beautiful.
And wasn't it, I think, medications?
No, and then orthostatic blood pressure.
The orthostatic hypotension, yeah.
So even if you have to assess a patient doing physical exam, the first thing you want to do is to check the blood pressure. Number 2, you want to do a cardiac exam. Number 3, you want to do a visual acuity, because if their eyes are also not good, that can be a problem. Number 4, you want to examine the feet and the footwear of the patient. And then you also want to do a performance-oriented assessment of mobility in the patient. And then we have what we call the timed up and go test. So that is like, I'm sitting in a chair, right? So the patient is in the office, and then you tell the patient, get up. So you're looking at how the patient is trying to struggle to get out of the chair to walk. That is the timed up and go test. And then you also want to do a musculoskeletal exam. And last but not the least, you want to do a neurological exam as well in this patient. These are the areas you want to focus on so far as the patient's physical exam for the risk of falls are concerned. So now, when we talk about the musculoskeletal system itself, what are the examinations we want to do? Number 1 will be oriented mobility assessment. Number 2, again, is the get up and go test. Then the functional reach tests, tell the patient to reach out for something. And then we also have what we call a short physical performance battery. We don't need to know all the details, but you just need to know that in a patient who has falls, we are going to do a musculoskeletal exam. And with a musculoskeletal exam, especially those who will be taking the exam next year in 2025, where all the exam is going to be MCQs, you want to know some specific things, so that, for example, if I drop something to you that, hey, look, you have a patient who has a history of falls. The patient needs some musculoskeletal evaluation. Which of the following will be part of the musculoskeletal evaluation? You will know that you want to perform, do the performance-oriented mobility assessment, the get up and go test, the functional reach test, and then the short physical performance battery test. Okay, good. And other physical exam things you want to do, we've talked about the postural hypotension, checking the blood pressure with the patient lying down and sitting up, visual acuity. You even want to do a hearing assessment as well. And then you want to examine the patient's feet. The patient's feet, you want to check bunions. You want to check the bunions. Because if there are bunions, the patient may have pain walking. You want to check for palluses on the foot. You want to check for arthritic deformities. And then you also want to even check if the patient has any neuropathies, because if the patient has diabetes, we saw that diabetes was one of the risk factors. So if the patient has diabetes, the patient may then have, some peripheral neuropathy, and that can affect mobility. And then you want to do neurological exam, lower extremity strength and gait for this particular patient. All right? Physical exam.